Hi, I'm Carrie.
I'm Misty.
And I'm Heather, and we're doing a project on Lynch syndrome, a genetic mutation MSH2 that I carry.
So what is Lynch syndrome? Lynch syndrome is a hereditary non-polyposis colon cancer that's better known as HNPCC. It's a genetic mutation of one or more genes that protects you from getting certain cancers. This genetic disorder does not have phenotypic features typically, and about 95% of people with LS do not know that they have it.
So how do you know if you do have it? LS is an inherited gene, which means that somebody in your family more than likely is going to have been diagnosed either with Lynch syndrome or with colon cancer or one of the associated cancers. A blood test can determine whether you carry the mutation for Lynch syndrome, but not everybody with Lynch syndrome has an identifiable mutation, so studies are still being conducted. Screening tests of tumors are also used to confirm the presence of Lynch syndrome, such as the microsatellite instability test, or MSI, or the immunohistochemistry testing, IHC. So what causes it? LS is a mutation of one of the main genes in the MMR family. MMR is the mismatch repair family, which is a process that fixes mistakes before your DNA is copied. MLHL, MSH2, MSH6, PMS2, and EpCAM are the genes that we know about that are affected in a mutation, and any one of those can prevent them from working properly, which leads to certain cancers. LS is a germline mutation, and about 40% of the people with LS have it because of a mutation of the MSH2 gene. It's an inherited autosomal dominant disease, which means that even if you only have one parent who carries that mutation, you can still get it.
So the risk for Lynch syndrome cancers and MSH2 mutation carriers is significantly increased more than the general population. For instance, colorectal cancer, the general population's percentage that will inherit it or end up getting cancer, colorectal cancer, is 2%, as to opposed to people with the mutation of MSH2, Lynch syndrome, will have an 82% chance in their lifetime of getting colorectal cancer. Endometrial cancer is 60% for LS and 1.5% for the general population, less than 1% of the general population for stomach cancer, but people with LS will have a 13% chance, and ovarian cancer, the increased risk is 12% as opposed to 1% for the general.
In the case study that we discovered, we had a 63-year-old female that had a family history of colorectal cancer. In this table, you will see the cancers that she was diagnosed with over the course of time throughout the case study. After the age of 61, we do not know if she was diagnosed with any more due to the case study being completed. Some of the cancers that she was diagnosed with consisted of ovary cancer, breast cancer, and then as you see, there's a couple more listed.
Okay, there's not yet a cure for LS, so instead medical professionals are relying on early detection practices and preventative measures for treatment, including colonoscopies every 1 to 2 years, starting at the ages of 20 to 25, or 2 to 5 years prior to the earliest cancer in their family line. It also includes they take daily aspirin to reduce their risk of cancer. Some have had to have hysterectomies to avoid getting cancers, as well as blood tests to detect ovarian cancer, urinalysis, things like that.
As Misty mentioned earlier, the inheritance risk, you have a 50% chance receiving this genetic disorder if one of your parents was diagnosed with this.
So here's our phylogenetic tree. As you can see, the genes are pretty closely related, especially regarding humans and chimps, bonobos, gorillas. But then we also have this guy down here, the large flying fox, which is a bat. And we just thought that was kind of interesting that a large flying fox has the same genetic disorder that potentially we can have, or chimps or bonobos.
And on this page, we have our citations listed that we got all of our information from.
Bye. See you later.